Okay, so I'm going to do another talk for men about women with borderline personality disorder. This time, unlike others, I am not issuing a disclaimer for the sake of those who have the disorder. If you need a disclaimer, I've linked to one in the low bar. That said, most of my other material has focused on why men should avoid relationships with these women. I've outlined the likelihood for the potential hazards borderlines bring with them: chronic manipulation, false accusations of physical and sexual abuse, self-mutilation, suicide attempts, and I put that in scare quotes. Substance abuse and infidelity are just some of a string of possible living nightmares that await you in any relationship you might have with one of these women. And as hazardous as being attached to a borderline can be, it only gets worse when you break up with or divorce one. As always, my first and only real suggested reaction to encountering borderline women in your relationship life is to run like Forrest Gump. However, let's assume for a moment that you lack the sense not to run into a minefield wearing snowshoes. Perhaps the allure of the crazy hot sex is just too much. Maybe she has love-bombed you Hiroshima style, and you're sitting up on that savior's perch she's built for you, stupidly confident that she'll never knock you off. Maybe you just need to be a white knight, being as you can't handle birds with intact wings. Stranger things have happened. But if none of the pitfalls of being tethered to a borderline woman is enough to dissuade you from taking that kind of plunge in life, I'm hoping the information you're about to hear will at least give you a contemplative pause before you ever entertain the idea of breeding with one of these women. And in case you're wondering, it's not because of the potential for child support, parental alienation, and the other side effects of breeding with your average cluster B, though those things are certainly on the table. What I am talking about is the physical health and developmental well-being of your child, both of which are placed in jeopardy when a child has a mother with borderline personality disorder. And that holds true from the moment they're conceived. Borderlines have an unfortunate tendency to smoke, drink, and drug their babies into premature delivery, low birth weight, and birth defects like fetal alcohol syndrome. Not to put too fine a point on it, but borderlines are just plain bad for children during pregnancy and every day after. This isn't a matter of speculation on my part. What I'm about to tell you comes straight from medical and psychological research, which I will link in the low bar. We will begin with a 2015 study on perinatal psychiatry by the Royal Australian and New Zealand College of Psychiatrists titled Borderline Personality Disorder in the Perinatal Period, Early Infant and Maternal Outcomes. They utilized a control group of 14,313 women classified as healthy, and an experimental group of 42 women with a clinical diagnosis of borderline personality disorder. Both groups were studied over the same period of time in the same medical facility. From the results, we start to get a picture of life for the child of a mother with borderline personality, from the point of being a newborn and into late infancy. I am reading from the paper as follows. Results. Women presenting for obstetric services with a clinical diagnosis of borderline personality disorder experienced considerable psychosocial impairment. They anticipated birth as traumatic and frequently requested early delivery. High comorbidity with substance abuse was found, and high rates of referral to Child Protective Services. Mothers with borderline personality disorder were significantly more likely to have negative birth outcomes such as lowered Apgar scores, prematurity, and special care nursery referral when compared with controls. Okay, a few brief explanations are required for some of the terminology used in this description. Psychosocial impairment, also known as psychosocial dysfunction or psychosocial morbidity, refers to abnormal emotional and cognitive features of a person's personality. As you'll see going forward, this can have a profound negative impact on maternal functioning and subsequently on your child's psychological development. Comorbidity, in the psychiatric sense, simply means the simultaneous presence of two or more psychopathologies in one person. In the case of borderline personality, we frequently find comorbidity with substance abuse, depression, and other disorders. Apgar scores measure your child's physical health at birth, assessing heart rate, respiratory effort, muscle tone, response to stimulation, and skin coloration. Apgar scores are actually the results of two tests, one at 1 minute after birth and another at 5 minutes after birth. The 1-minute test assesses how well the infant tolerated delivery. The 5-minute test determines how the infant is faring outside the womb. On average, the children of borderline mothers score lower on both tests. This last area is significant, as the study results show that babies born to borderline mothers are more than twice as likely to have physical complications that require placement in neonatal intensive care units or specialized skilled nursing facilities. Fully 1/3, 33.3% of newborns to borderline mothers required specialized placement. 12.6% of the control infants scored lower than 7 on Apgar assessment compared to 25% of infants from borderline mothers. Again, more than twice the risk. Unfortunately, that is not where the problem ends, it's where it starts. Once the birthing process is done, there are developmental perils facing the children of borderline mothers that occur during the crucial time of early infancy. To start getting a picture of this, I refer you to the British Journal of Psychiatry in a study titled How Mothers with Borderline Personality Disorder Relate to Their Year-Old Infants. The study primarily concerns itself with the consistency and stability of the mother's emotional bonding with their infants. The results were unsurprising given the pronounced instability in relationships demonstrated by borderlines with other adults. Reading from that study, they concluded that a higher proportion, 85% of women with borderline personality disorder than comparison groups showed disrupted affective or emotional communication with their infants. They were also distinguished by the prevalence of frightened, disoriented behavior. They went on to say in their conclusions that maternal borderline personality disorder is associated with dysregulated mother-infant communication. To understand the real-world implications of this clinical language and to reframe it in more plain-spoken vernacular, I refer to the Encyclopedia of Child Behavior and Development and to their definition of the synonymous disorganized, disoriented attachment. From their webpage, it is, and I quote, "A child who exhibits behavioral disorganization or disorientation in the form of wandering, confused expressions, freezing, undirected movements, or contradictory, i.e. unorganized, patterns of interaction with a caregiver. Most of these children have histories of maltreatment and may exhibit fear of the caregiver." Unquote. Another paper from the British Journal of Psychiatry that explores the unhealthy impact of borderline mothers on the development of their infant children is titled Still-Face Interactions Between Mothers with Borderline Personality and Their 2-Month-Old Infants. The paper's authors described the borderline mothers who participated in the testing as, and I'm quoting here, intrusively insensitive toward their infants. The infants in the study were noted to have increased looking away and dazed looks. They also said that the interactions for the infants were less satisfying and that the infants demonstrated lowered affect after the still-face interactions. In other words, after interactions with the mother, the infants began shutting down emotionally. To illustrate this more clearly, let's take a look at the following short video, demonstrating what happens to the infant state of mind when the mother presents affectively consistent with what we would see in borderline mothers.
Babies this young are extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. In the still face experiment, what the mother did was she sits down and she's playing with her baby, who's about a year of age.
I'm my girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this, and then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, "Come on, why aren't we doing this?" Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it. They actually may lose control of their posture because of the stress that they're experiencing.
Okay. I'm here. And what are you doing? Oh, yes. Oh, what a big girl.
It's a little like the good, the bad, and the ugly. The good is that normal stuff that goes on, that we all do with our kids. The bad is when something bad happens, but the infant can overcome it. After all, when you stop the still face, the mother and the baby start to play again. The ugly is when you don't give the child any chance to get back to the good. There's no reparation, and they're stuck in that really ugly situation.
At this sensitive stage in life, the interactions of a child with his or her borderline mother are quite possibly damaging. If you've ever had ongoing interactions with a borderline woman, then you know the destructive effect they can have on the individuals with which they have formed an emotional bond. These studies imply the possibility that even in the nonverbal realm of communication with their own children, love or even maternal instincts don't override the pathology to provide protection for the child. If you use this information to form a template for what the child can expect over the term of its developmental life, it would be entirely reasonable to see it as predictive of multiple ongoing blows to the child's mental health. Compare now what we know of the children of borderline mothers to those not suffering from disorganized attachment. Children of healthy mothers show distress upon separation from the mother, not from her presence, as we often see with borderline mothers. Mothers of securely attached infants can quickly have a soothing effect on their children when they're distressed. Not so when the attachment is disorganized, as it is with borderline mothers. It is very important here to point out something about groupings in the Australian study. The group labeled healthy might have been better named non-borderline, as it included a variety of psychopathologies other than borderline personality, including major depression and schizophrenia. The control group did not screen out these other disorders. Obviously, and as the studies concluded, the borderline patient presents some real challenges for obstetricians and related health professionals providing neonatal care. It is imperative that services be shaped to address the added risks that come with these patients for the patients themselves and for their children. It is also vitally important to reach out to men contemplating fatherhood with this information. They need to be able to make informed decisions that will give them the best shot at providing a healthy start for their children. And that is it for today's talk. As always, I hope you've enjoyed and that you've gained something from the experience. See you next time.